For me, I've noticed many years ago that, we have the chronic disease epidemic that we don't need to have, but then we have a solution for it, and that's the whole food plant-based lifestyle. But the real problem is that the solution is not implemented. So my primary focus is, how is it that for 4 decades we've known this powerful truth about food as medicine, and yet less than 1% of the world population is applying it. My work right now is to find some answers. I'm primarily focusing on what I'm calling the Grassroots Ambassadors. So anybody who's ever told somebody else, you might want to look at this because it could help you, I'm considering them an ambassador for the movement. How can we help ambassadors more effectively get their friends and loved ones curious so they can start looking and start, starts with curiosity and then a commitment and become whole food plant-based.
Welcome to the Plant-Based DFW Podcast Weekly Show with Dr. Riz and Maya, a show broadcasted from the Dallas-Fort Worth area that focuses on lifestyle medicine. This is the use of evidence-based lifestyle therapeutic approaches, such as a whole food plant-based diet, regular physical exercise, adequate sleep, and stress management to treat, prevent, and oftentimes reverse lifestyle-related chronic diseases that are all too prevalent. Every week, they feature a guest who speaks on one of these lifestyle medicine pillars. This show is for you, the person who is seeking to improve your overall wellness and quality of life. So whether you are driving, walking, or relaxing at home, we hope this show will provide you one more tool for your wellness toolbox. Let's meet today's podcast guest.
Peter Goldstein is on a mission to figure out how we can ignite curiosity in our friends and loved ones about the benefits of consuming a plant-based diet. In this episode, we talk about the mastermind group that he has created to find solutions as to how we can effectively spread the message about the plant-based lifestyle. His main initiatives are focused on supporting the Grassroots Ambassadors. These are the people who are already on board and have already started sharing the message. Also, he has created a scoreboard where you can chime in to share about how you have benefited from the plant-based lifestyle. Make sure to visit wedidit.health and chime in. Also, just another reminder that the Lifestyle Medicine Conference is happening here in the Dallas area, November 7th through the 10th. To learn more about that, visit lmconference.org. Hope you enjoyed this episode. Peter is a former CEO of Technology and Software Systems and a lifelong advocate of personal power and conscious business practices. Over the past 10 years, he's been tracking a mounting body of evidence that demonstrates that we can save as much as 75% of healthcare costs in the U.S. and eliminate the associated human pain and suffering by simply changing food-based lifestyle. Peter is dedicated to changing that calculation during his own tenure on the planet. Welcome, Peter.
Thank you very much, Maya. It's such a pleasure to be here with you. That's such a beautiful introduction, and thank you so very much for your kind words.
Well, Peter, I've seen you do a lot of work with your HippocratesDocs.com website. You've done a summit. I'm hoping that we can focus on what is important to you today. So I just read your bio. Is there anything else that we want to add to that?
Well, my focus, I have been really intrigued with what a huge difference, how powerful food as medicine, specifically a whole food plant-based lifestyle really is. And I've been astonished that more people aren't practicing it. And so currently, my frustration, the question I'm asking, the place that me and my team would like to offer value and support is to see what it is that we can be doing to accelerate the expansion of this movement. This is a 40-year-old movement. It's been 40 years ago that Dr. Campbell uncovered in his research in the laboratories at Cornell University. He found that cancer cells thrive on animal protein and die from plant protein. So the evidence has been mounting for over 40 years now, and we probably have hundreds of thousands of studies at this point that show the power of nutrition and the importance to fuel our bodies with what it is that our bodies need, with the things that our immune system needs to be able to fight off all the things that come at it throughout our lives.
So if we've known this, if there's been evidence, the China study, and so many different resources that we now have that prove that we can actually reverse disease, why? Why is it that there's not this huge movement now?
Well, you know what, Maya, that's exactly what it is that we want to uncover. So how is it that just about every single person in this world could be healthier, happier, more vibrant, fewer aches and pains, everything you could possibly think of? There's probably very few people who couldn't be a little bit better at that, and some people who could be a whole lot better at in their health. How is it that people haven't embraced it? And that's the question that we're currently tackling. And with our initiative, our new website, our initiative for this is wedidit.health. And so to celebrate the people who have embraced the whole food plant-based lifestyle and really figure out how is it that we can get the other 99% of humanity to become healthier.
And how is it that your team is kind of projecting that this will move in terms of getting people on board to spread the word?
That's a great question. You know, maybe I'm fooling myself, but I think if I am, you are too, and so is Dr. Riz and everybody else. But we really believe that this is an absolute truth. I mean, there's things that are absolute truths, you know, like if you drop a ball, it will fall to the ground. That's an absolute truth. It's an absolute truth that everybody who's changed to a healthier lifestyle and the whole food plant-based lifestyle, everybody has benefited. Absolutely everybody. So it's a truth. It's an absolute, and it has to be, and it will be. And I'm encouraged. I keep seeing evidence that it's getting more and more traction. But honestly, for something this big and this powerful to have so little traction after 40 years is, to me, is mind-boggling. And at the same time, the flip side of that is that this is a huge opportunity to add value to help make this a better world for my friends, loved ones, my family, for absolutely everybody.
As you're talking about, finding solutions, I'm thinking about your background as a software developer, and really what you focused on was finding solutions. So now you're working on finding solutions in terms of really helping to build a momentum of spreading the word that a plant-based lifestyle really can reverse some of the health conditions that we have or even prevent. So now, where do we start though? And I know that we're in the process of finding the solution, but do we start with people like ourselves who are already on board and working with our community?
Absolutely. So that's where we start. We have all that in place. So our initiatives, and I really cannot claim starting anything, because obviously for at least 4 decades now, the greatest doctors around, and there's thousands of them, have started and done so much. So we're not starting. This is 4 decades old now. But I believe that with our efforts, we're taking a different perspective on it. So I'm wanting us to step back and take a look at what's working and what can we do better. So, for example, it would be so great to come up with let's say a best practices list for when one of our ambassadors, somebody who's practicing this lifestyle, when we're talking to a friend or a loved one, how is it that we can get their eyes to light up? How is it that we can get them curious? Because that's where it all starts. I believe our first step is to get people who don't understand this, who haven't embraced this lifestyle yet, to get them to be curious, to say, well, you know what? Yeah, there's tens of thousands of people who bypass surgery, and who didn't have to have an amputation, they reversed diabetes. People who are doing so much better. What is it? How is it? And what's in it for me? So people can look and say, I'm on 5 different meds, and it's getting worse and worse all the time. I'm obese and I'm getting worse and worse. There is hope. There is a solution. I want to know something about it. So that's where we're starting. The question is, how can we ignite curiosity in our friends and loved ones so that they too will say, gee, maybe there's something here. I need to do a little research. Show me some of this information. Introduce me to the work of some of these great doctors.
So what you're saying is, and I'm thinking of my own life, a lot of us who are plant-based are the only ones in our family. And there's that frustration that builds up over time. A lot of us just really want this way of living for our loved ones. We try different things. We try motivating them with documentaries, literature, tasting the delicious food, and somehow some things are not working. Are you talking about developing sort of like this protocol or program that a lot of us can follow that has been proven to work to help convert people?
This is beautiful. Yes, and sort of. So but there's nothing like it. So we're really pioneering a new frontier here. But that's it. And so, but when you look at how do we convert somebody, and that's such a big word, and it's not really my favorite word in this case
Okay.
by any means. But how do we ignite their curiosity?
I like that. Yes.
It gets very complex because everybody's psychology is different. So what I might say to somebody who has one personality type and maybe one thing to get them curious, what I may say to somebody else who has a different personality type and maybe something else. So really what we're wanting to do is start conversations with people outside the movement. Well, not necessarily outside the movement, but traditionally in the movement, we go to our doctors and nutritionists to get the answers. And that's where all this body of evidence comes from. But let's ask some psychologists. What's the psychology of getting somebody to change habits? What's the psychology of getting somebody interested? What's the psychology of getting somebody to change their values and their thought processes and their beliefs? Mm-hmm. So it's a fresh angle. So asking people, so Maya, if we're all frustrated trying to talk to our friends and loved ones, but what succeeded for you? Do you have a situation, and if you can think of one, I'd love for you to tell me about it. Can you think of a situation where you ran into somebody new or an old friend or anybody who you were able to say something to, and they lit up and they said, wow, this is incredible. Tell me more. How do I find out more? So have you had that experience? What worked for you?
In terms of helping other people adopt this lifestyle?
Just even get curious about it. So somebody who, and I don't know what their thinking is. What are they thinking? Are they thinking this is too good to be true? Are they thinking that this is some wacko doctor out in a cave in the Pacific talking about this stuff? I have no idea. What are they thinking, and how'd you get through to them?
That's a good question. There are a variety of different people that I come in contact with that are interested or have, asked questions about this lifestyle for various reasons. One of them being just wanting to lose weight. That's the initial reason why they want to adopt this lifestyle is it's working for you. I've heard that other people can lose weight, so I'd like to adopt this lifestyle. And then, of course, you hear other people that know that they can, lower their hypertension or their high blood pressure and maybe manage or even reverse their diabetes. So it could be hypertension, cholesterol, diabetes. Those are the main reasons why people take interest.
Personally, I come at it initially from the human health perspective. I really get the impact that we have on the animal kingdom, of the impact we have on the environment. I mean, it's amazing. So really, that's a really important, really huge side benefit is that we're, the average American takes, I think, 100 animal lives a year, and takes 2,500 gallons of water to get a pound of meat. I mean, statistics like that are just amazing. I mean, I sure care about the planet, and I'd love to conserve water and the air pollution and everything else too. But that's part of the effect. So changing to a whole food plant-based lifestyle is not only impacting human health, but it's impacting the health of the animal kingdom as well as the planet.
When I think of health, and I'm a big believer of lifestyle medicine, and I do sort of consider myself a patient advocate in terms of really wanting to provide resources for people to take control of their health. One of the things that fascinated me about lifestyle medicine, there's a psychological component when they're training physicians and dietitians to be boarded in lifestyle medicine. There's that whole knowing how to interview a patient or a client, the motivational interviewing aspect of it, the psychological component to it, which is like asking these questions like what you're sort of asking. Why are you interested? What's holding you back? And doing this goal setting, which is realistic. I'm familiar with the process that they take. And that, for me, is part of what I wish we could continue to implement. And even people that are not specialized as a physician, for example, or a dietitian, some of us could use those tools with our loved ones.
Absolutely. That's beautiful. I'm so glad to hear about that, and I'm certainly going to reach out to the American College for Lifestyle Medicine and see how that process works, and maybe they'll work with me a little bit to see how we can adopt that too. So we're calling it, our target is the Grassroots Ambassadors. So people who are not practitioners, who are not professionals, just somebody who's a consumer, somebody who's benefited, and somebody who'd like to then have their friends and loved ones be healthier. So we consider them ambassadors, and our focus is how to help them be more successful doing that. And what the interview process you just described is absolutely right on for certainly needs to be modified, because none of us grassroots ambassadors are physicians or practitioners. But how can we as lay people use some of those strategies? So that's a beautiful idea. I'm going to reach out to them immediately and see if I can collaborate with them, our team, with what we're doing, because that's really exactly what we're trying to do, is figure out how can we talk to our friends and loved ones to get them curious.
Exactly. And I like, by the way, the name of your program, or what you just said, the Grassroots Ambassadors, because that's how movement happens, is with the people themselves at a grassroots level. And some people are on a spectrum, right? And I'm not even sure if that's the right word, but people are along a spectrum of readiness, I think. And then we just need to know when that they're ready, or what to introduce to move them along the way. So with our work, what we try to do is just plant a seed. And we're not the only ones planting seeds, but we're just planting a seed.
Absolutely. It's been a long time ago that I heard, but I guess I'll never forget it, is somebody said it takes a human, 6 or 8 times to hear about something before we start really accepting it. So if we're just getting somebody else to hear something that they're not rejecting, then maybe we really are one step further to, so there's a whole process, I suppose, to get them curious. So what is that? So just, and not to be antagonistic, certainly is part of it. How do we do this? How do we watch for the clues? What are the clues that they're interested or resistant, or there's so much to uncover about this. And what I love that you're liking this approach. But yes, it's maybe that's what this movement is missing, is because there's so much magnificence in there, so much great research, so many amazing doctors, so many amazing people in here, but some little thing is missing. So maybe that one tiny little thing that's missing is an active grassroots ambassador component to this. So just because every one of us, we're so frustrated. I mean, my sister, who's a pharmacist, she leaves the room if I start talking about food as medicine, and yet, she really could use better health, and everybody could. But I've learned not to talk to my family about it, because I get so much resistance. I pick up on that and back off. But so that's what motivated me. Actually, we have a very specific project that we're launching, and as a lead project for this whole effort. And that project is a wedidit.health scoreboard. So what we're asking people who are plant-based, who have benefited from a plant-based lifestyle, we're asking them to chime in. So we're asking them to tell us that they've done it, and then answer one question, one multiple choice question, to say, how have they benefited? So they can tell us that they've reversed their their cholesterol, that they've lost weight, that some people have reversed cancer and heart disease and diabetes. So one simple question for people who benefited, just to tell us how they've benefited. And then we're doing a live scoreboard. So that means that every time somebody chimes in and somebody says, I benefited this way, it appears on this live scoreboard. And then it's our mission to create an app that we can share with the world so that any website can display this scoreboard, that a live ticker. So a website can constantly show, 500,000 people have reversed diabetes, and the average person lost 50 pounds, and these kinds of numbers. And our hope and vision is that this scoreboard, it's a ticker. It will, I see it on a news show. That's going to be the final success, is to get a news show to display it like they do with the stock tickers, showing the wedidit.health scoreboard, that how many people have reversed chronic diseases. And I'm hoping that will be a very powerful talking point for the Grassroots Ambassadors, so that, when I'm talking to somebody and I see that they just don't believe it, then I can say, but 280,000 people have reversed their diabetes. You're coming from the doctor, and the doctor's diagnosed you as being pre-diabetic. There is an alternative. So maybe that will get them curious to say, wow, that many people have benefited. So that will draw them and get them curious and get them to look at some other things. And then we're building out a whole website so they can come to our website. We want to be the host for the movement. We'd love for somebody new to come in and be able to see all about all the work of the original heroes and all the greatest documentaries and the books and the research studies and, Dr. Greger and Dr. Barnard and everybody's work, so that somebody who's new to the movement, they can easily look for all the things that they can be curious about and do more research, and to find the doctors and nutritional coaches that can help them on their journey.
Couple of questions about the scoreboard before we move on to all that you just spoke about. For a couple of years now, you've been talking about the scoreboard. Now, is this a software that you've developed, or your team?
Our team is actually in process of developing. So I'm really happy to share that we actually launched the project on May 31st. And so we've launched it, and as everything, especially with technology, everything you get it out and you keep improving it. So we've launched it, and we've decided to make some great improvements on it. So right now it's in process of getting to the next version. We wanted to simplify. We actually had 30 questions. Well, we can just keep it to one question, just so that somebody can come on and make it really easy for them to share their information. And then we'll have other ways to get more information if somebody wants to share it. But right now, we're going to launch this campaign to just answer one question. If you've benefited from a whole food, plant-based lifestyle, just tell us how, and we'll add you to the scoreboard and give you the opportunity to help perhaps millions of other people.
So are you saying that right now, if our listeners go to that link, that website, which I'll have in the show notes, they can simply chime in?
Yeah, so the website to go to is wedidit.health. So it's not a .com, it's a .health, wedidit.health. And today on June 4th, it's in the old version. We'd like for people to come once we launch the new version, which will be, I'm sure by the time anybody's listening to this podcast, we'll have it available. So we would really love for anybody who's a Grassroots Ambassador, first of all, to take, a minute to tell us how they've benefited, that can then help millions of people with the scoreboard. And then further, if they would want to be part of our community and share information with other ambassadors and help us in this mission and we can't do this by ourselves. We need for the other ambassadors, we need to collaborate. We need to be asking these questions. How is it? What are best practices? What are the things that work in getting somebody new to be curious about all the magic that's happening in this movement? Really, it's magical. This healing is absolutely magical. It's just unbelievable. And sometimes I think that the reason this movement hasn't grown so much more is because when somebody doesn't know about it, if they hear that, oh, it's diabetes and heart disease and all this is absolutely preventable and reversible, then they're saying, oh yeah, sure, some fairy tale. There's no way this is true. So if we can show them that hundreds of thousands and millions of people are benefiting, then maybe they'll have to say, wow, maybe this is true. Maybe it's worth looking at.
I myself, you addressed it earlier about sort of no longer being interested in speaking to your family because you feel like you just continue to push them away. A lot of times I find myself in those situations where I really don't want to mention it when I'm at a gathering with my neighbors, because the last thing I want to do is create enemies or tension. So what you're kind of saying that is your program would give us the tools to know how to have these conversations with various people.
And that's what we're looking to figure out. And again, that's a collaborative effort. I want to lay the groundwork, the platform, the environment for it. And I would like everybody who's interested to participate and have conversations. So that's what, I want to have a summit, but not about a disease or something nutritional. There's plenty of those, but I'd like to have a summit of how do we talk to our friends and loved ones who aren't interested yet, and have feature people who are psychologists and behavioral change kinds of people, as well as the doctors that are part of this movement for sure, but to also include other things about behavior and psychology and bring that in. I feel like that's really missing in this movement.
You are right. That is awesome if you can do that, if you can put that together. I'm thinking also of like the cultural component and the fear of losing a connection with loved ones because of our culture, our social connections. Also, maybe even addiction, just because we are addicted to certain additives and preservatives in foods.
I so appreciate you saying that. And, you and I have talked for years now, and I really look forward to collaborating with you as we bring some of this together.
Is this something that you'd like some input or feedback? You'd like to hear from our listeners about what could possibly work?
Absolutely. That's totally what it's about. And as we're building our new website, it's social media based. So it's going to be a little bit like Facebook. We want people to interact and exchange ideas and make new friends. And the primary topic of conversation is, how do we get through to our friends and loved ones? How do we get them curious? And then once they're curious, how can we, because we all want them, once they're curious, we want to help them find their resources and and help them get started and guide them on their journey. And this is a journey. It's a lifestyle change. So it's a whole new lifelong journey. So how do we get somebody curious? That's the first step. But the platform is about how do we connect? How do we collaborate? So not how, but actually providing a platform so we can connect and collaborate. And have events and conversations and panels and think tanks and summits and events and start really focused on how do we get through to the people who aren't part of this movement, and and to support the wonderful work the doctors are doing. I mean, I know Dr. Riz and so many other doctors, they'll never miss an opportunity to talk in front of a group and explain, all the medical reasons and all the great benefits. But this is to come at it from the whole other perspective, come at it from the grassroots perspective.
I appreciate that. And it almost sounds like a mastermind group. You've heard the message. So there's a component that's missing. It's exactly what you said, Peter. Like, there's a reason why a person, despite the fact, it's not that they don't know the knowledge. You think of, for example, smokers, and this is not at all a conversation about shaming, but many smokers have heard the message of the consequences to having years of smoking. It's not that they don't have the information, it's that creating the change is where the difficulty comes in. So this think tank that you're creating is about brainstorming, how can we help people make the change? It's the how to, is what works, what doesn't work.
Absolutely. And it's interesting with smokers, that's it's been a number of decades now that smoking had become taboo in our culture, and a lot of people have quit smoking. but there's so many similarities, and I guess the stop smoking campaign, lifestyle change, as it were, is 50 years older than, well, it happened, what happened 30, 40 years ago, that, I mean, I remember, and you're probably too young to remember this, but I remember people smoking on airplanes and smoking in every restaurant, and
Mhm.
smoking everywhere. I mean, people always smoking everywhere. We've changed a lot. But so now the shaming thing, so now the people who are smoking, I think they feel that they don't want to. They feel powerless. They're struggling to quit smoking. So there's a whole different addiction
Mhm.
status on it. But certainly salt, sugar, and oil are addictive, um, and so there is an addiction component here too.
So let's talk more about the grassroots ambassadors and how people can join that movement. And I know you've said that you're still in the process of developing a lot of this. So we'll have the link, as you said, to the website. But what entails being a grassroots ambassador?
It's really simple. If you're benefited from being plant-based, and if you've ever told somebody, recommended to somebody that they should take a look at it, to me that makes you an ambassador. So we have ambassadors who are, really casual on that level, and we have ambassadors who are going door to door like an evangelist, just talking about it every chance they get. So we have ambassadors at different levels. But to me, anybody who's frustrated that their friends and loved ones haven't heard it and don't listen, and anybody who's gone and gone out of their way, or created a conversation or said something about, you should take a look at a whole food plant-based lifestyle. So the best way to put it is, anybody who's ever recommended that somebody look at a whole food plant-based lifestyle, that makes them an
Mhm.
ambassador.
Right. Okay. That sounds easy enough.
Easy enough. So yeah, and all the ambassadors, I'm assuming, and that every ambassador has shared this frustration of having a deaf ear turned when they know so deeply, so passionately know that the person they're looking at could benefit so greatly. So,
Mhm.
whether it's aches and pains, or getting off some medications, or losing a ton of weight, or whatever it is, it's a frustration to look at a human being that we care about, look at them, and know that they could so easily have so much help, and they don't want to hear it yet.
We often talk about the disparities in healthcare, and then, of course, the food deserts. And so we talk about how we can try to fill those gaps by educating people on how they can economically make a transition, where they can find some of these whole food, plant-based ingredients without having to spend a lot of money. There are gaps everywhere, right? I mean, we can continue to talk about the gaps.
Absolutely. But, for me, the primary gap is in somebody making a commitment. So when somebody, so it takes a while in our culture, with the way, and I'll use the term brainwashed, we're brainwashed to think about food. And so it takes a while for somebody to know that yeah, there's a whole different set of beliefs that serve ourselves a lot better. So that's the biggest obstacle: somebody coming to make a commitment, somebody to shift something. And one of my favorite teachers is Tony Robbins, and he'll tell you that we can change in a second. So if the right environment, the right thoughts, the right thing happens, we can shift in an instant. So
Mhm.
it's that environment, it's that ability to make that shift. That's important, I think. And so to make the shift, to want to do something, yes, there's things that are going on, but once we want it, there's support there, and this community will bring that together. Um, so let me, if I may, take a couple minutes here and talk a little more about our website, because so our scoreboard is our first initiative and our first project, because I think that will have a huge impact for people to really see how many people have bypass surgery, and reverse type 2 diabetes, and those kinds of things, because those numbers are huge globally, and we are doing this globally. Um, but then also we want to have a huge platform for testimonials. So somebody says, well, maybe I'm pre-diabetic. I'd love to see what other people have done. They'll be able to see thousands of testimonials by people who've reversed diabetes. Another initiative is a peer-to-peer mentoring program. So somebody says, I'm kind of new to this. It'd be great if I could talk to somebody who is diabetic and they're further along than I am. So then, somebody who's been on for a while, somebody who's an ambassador, somebody who's reversed diabetes, they may want to team up and have conversations. Yeah. So in addition to doing the think tanks and the exploration and about how do we get people curious, we want to find ways to support each other through this process.
Sounds like a wonderful program. You found a need. You found a missing component there that you can fill. And I like the idea of supporting each other. And then we as grassroots ambassadors go out and support people that are making this change, that are new to the lifestyle. Is there anything else that you'd like to share with us?
I would love to say, come to wedidit.health, to the site, and sign up for our newsletter so we can keep you updated with as things are evolving and developing. I'm so honored to be with you. I really appreciate you featuring our work here. But we are a brand new baby. We're just at this moment we're not even a week old. So we need everybody to help us grow and nurture us, and so we can serve. And it's really about us all being in this together. And we're all so passionate about the world being healthier, and people as well as animals and the environment, and this serves all of it. I mean, the dream is that the scoreboard will show everybody how many people are benefiting, and at the same time on the scoreboard will show how many animal lives we've saved, the people who have transformed their lifestyle, how many animal lives, and how much air pollution we've saved, and how many trees, and how many gallons of water, because all that is so powerful, and that will all be on the scoreboard. And visualize it with me. Just see a news program that has the ticker running across the bottom that shows 580,000 people have reversed type 2 diabetes, and 800,000 have bypass surgery, and we've lost, 500 million pounds of weight. And that's the vision here, is to be able to show those numbers. I know those numbers are real. Once, people are willing to take, a minute to just share with us that they've gotten healthier, and in what ways. And so really just one multiple choice question, and that will impact millions of lives.
You will be here in November at the Lifestyle Medicine Conference. Tell us what to expect. How can people find you? Are you going to have sort of like an exhibit, a booth, or something like that going on?
Yes, we are going to get a booth or a table, whatever. I'm not sure how it's presented, but yes, we will have a commercial presence. So we will have information, and so we will hope that everybody who's there will come and search us out, so we can have a conversation and exchange ideas. I think this is for me so very exciting, because as in our conversation today, our energy, our enthusiasm had elevated, and I love having conversations like this. I'm looking forward to being at the American College for Lifestyle Medicine conference and having tens and if not hundreds of these kinds of conversations.
Yeah, I want to add that you and I have never met in person. But we've had multiple conversations via Zoom. So to see you face to face is going to be fun.
It's going to be a lot of fun.
Will people be able to chime in there? Like, will you have a setup where they can chime in, or will they go on their phone?
I think we need to be at a place where people can go on their phone. I mean, it's just that simple. It's really going to be just one multiple choice question, and that's easy enough to get on an app. So people would be able to go on their phone. I'm sure I'll lend them my phone if they don't have one, but I'm sure we'll figure out a way for people to do it there and to become part of our initiatives. I mean, it's we're going to have subgroups to figure out these challenges. I mean, that's really our initiative, is to find these answers and implement these answers. So the questions are, how do we get our friends and loved ones curious? Because
Mm-hmm.
it's such a huge truth and so important, and yet, you know, less than 1%, I'm pretty sure that's a correct number, but less than 1% of the world is really on board.
Hopefully, this initiative that you've started will create a change so that we see that percentage go up. I have,
Together we'll do that.
right, together we will do that. I have one final question for you, Peter.
Yes.
What keeps you motivated on a daily basis and keeps you ignited?
Oh, that's a great question. What keeps me ignited? I feel better all the time that when I'm eating healthy. And, for me, my history is I spent most of my adult life about 50 pounds heavier than I am now. And my triglycerides and cholesterols weren't high. They were off the charts high. And I've lost the weight, and I brought my blood work back towards normal without medications. So that's what keeps me motivated. And honestly, I mean, I'm constantly acknowledging the infinite intelligence that my immune system is, and I'm loving how powerful it is, and I'm loving this opportunity to be able to support it with the ammunition my immune system really needs to be able to stay healthy and go strong. And honestly, my lifestyle has been really challenging. I travel a lot. I live in Colorado. I have a 96-year-old aunt in New York City who I spend time with. She likes to have my company, and I have family in Cleveland. My mom, my 91-year-old mom, have a couple grandkids, son and daughter, and sister. I have all kinds of family, so I'm really on the run. I'm living in the fast lane in a sense, and so what keeps me going is my appreciation that this wonderful body that I have is staying healthy and strong, and keeps going and takes me to do all the things that I can do, and keeps me healthy and excited to be able to play with this solution. I mean, to me, this is fun to be able to figure this out and to make a difference and to add some value to humanity is my dream, and it keeps me going, is to be strong to be able to do that. And
That's true. This way of living has really made you available not only for your loved ones, but also this initiative that you started. And I think in a previous conversation, you said that you haven't been this excited in about 30 years, right?
well, yeah, it's probably been 30 years, but I was in the early stages of my technology business, and I was so excited. I mean, I remember I'd get up at 4 o'clock in the morning just to have quiet and peace and quiet, and I can get great work done, and I couldn't get out of bed quick enough. And I am that excited about this again. Yeah, I think at the core, my biggest passion, or one of them, is about delivering creative solutions to things, and this is just a huge opportunity to try and help figure out a solution to something that impacts most people. And and you asked me about what keeps me going, and I mean, I know that if I wasn't living this lifestyle, I would, instead of having lost the weight I've lost, I'd be 300 pounds. I'd be on, like 5 or 10 different kinds of meds and barely getting around. And I mean, I look around at people my age, and I see this huge difference in my health and the opportunities I have in my life because of my health.
Well, I appreciate you. I know you have a lot on your plate, and yet you made time for this conversation today, so I appreciate it. I know that you're caring for your aunt right now, and you only had just a little bit block of time to talk to us about this initiative. So, Peter, thank you so much for your time.
Thank you. Thank you, Maya. So appreciate you, and so look forward to all the things we're doing. I've had opportunities to work with you, and you've participated in some of our other initiatives, and it's always been so great working with you and Dr. Riz. I love
Yes.
working with, Dr. Riz is awesome, and so are you.
Oh, well, thank you.
Thank you.
Well, there you have it. Our conversation was with Peter Goldstein. I would love if you guys would comment about our conversation in terms of really wanting to create a space with resources to support people who are not fully on board with the whole food plant-based diet. Thank you again for listening, and let me know what you think. And make sure to check the link below so that you can chime in and talk about how you have benefited by becoming plant-based. Thanks again for listening. You've been listening to the Plant-Based DFW podcast show. If you like our content, please like, share, and leave a review. Our goal is to provide quality episodes to help support the community.